Hello. We all know obesity is quite prevalent in the world, and we also know that we advise as a healthcare provider to every patient, every individual to lose weight to best of their capacity. But there is a rising concern that weight loss is associated also with the loss of muscle mass, function, and the performance. And how to control this gradual progressive muscle loss is also a challenge for us as healthcare provider and for the patients. So different means of the obesity management is being in the market, including lifestyle medications and the surgery. Today, I'm Dr. Fauzia Rashid, Associate Professor MBRU and Consultant Endocrine in Dubai Hospital, 16th Congress of Emirates Diabetes Endocrine, having a pleasure of meeting with Dr. Salah Abusnana. Dr. Salah, can you please tell us about yourself?
I'm Salah Abusnana. I'm professor of endocrinology, practicing in University of Sharjah, where I direct the Tertiary Diabetes Center, where we have clinical services and academic side as well. So my pleasure to be with you today.
We are really glad to have you. Let's discuss about that this is a rising concern that the muscle loss is gradually increasing with the use of multiple medications even after the metabolic surgery. What do you think about that, how we can address this issue with our patients, and what preventive strategies should be undertaken to prevent this?
So if we go back for some time, most of the anti-obesity interventions, when it comes to the efficacy, it's not that high. But apart from the bariatric surgery, but recently we start have group of medication and also bariatric surgery, which might lead to very rapid weight loss. It's good, but on the same time, as everything on the other side, they might have side effect. And one of the recognizing feature is the lean mass, because what we want is people to lose the fat, but to preserve the muscle mass. So with the rapid weight loss these days, the lean mass lost as well. So in usual moderate weight loss, patient lose like probably 20% of the muscle mass, and the rest is from the fat. But sometimes the weight loss to the muscle mass is up to 40%. And this is where the muscle mass loss contribute, and patient might got problems with it.
And what do you think? In my practice, I always refer the patient to nutritionist before embarking the journey of the weight loss. But do we have any set points and to tell the patient what should be the rate of the weight loss and how they can avoid it? What should be the preventive strategy for patients to understand in clear terms and make this journey simpler and easier for them?
That's very, very, very important step and important question, because all the patients, they look for one outcome. And even us healthcare professional, before we used to look at what? At weight loss. Now, treatment of overweight and obesity, or those with overweight and obesity, we always tell them it's not only weight loss. So we're looking after all other aspects of life, whether it's the functional activity, whether it's the other outcome, the cardiovascular disease, the liver, the rest of it. So, and not only this, it's also the well-being. So the psychological well-being is very, very important. So education. So patient, before even the surgery, when we say we're going to start you on this treatment, or you are candidate for bariatric surgery, the nutritional status after that is very, very important. Because if the patient goes through the process of rapid weight loss, we have to make sure that he's not in catabolic state.
True.
Because one of the important things, the muscle metabolically are very, very important, because it's the source where the glucose got utilized. And also, it's important, the more muscle bulk patients have or muscle mass have, they have less insulin resistance, and at the same time, more sensitivity. Not only that, functionally. So when we ask patients, for example, to what they should do after surgery, they have to maintain a good lifestyle. And that's, if they don't have a good muscle mass, functional stats of those patients will be low. So going to the nutritionist, especially to tell them what are the requirements, not only the specific substrate they need to take, which is mainly protein, they also the amount of the protein and the stratification of the protein throughout the meal.
Very important actually, because if we talk about general protein intake, probably they will just give the usual requirement.
Yes.
But anybody who is on any kind of weight loss medication, or especially the post-bariatric surgery patient, they have to have 1 to 2 grams per kg of the protein intake until and unless they have some underlying condition of the renal disease. Another important thing, we as a physician, we always look for our diabetes prevention trial and look ahead trial, and we never thought of it.
Yes.
That weight loss can be, despite having hundred of other benefits, that one particular aspect of losing muscle, which we call medically sarcopenia, could be of concern nowadays. Yeah. And so many meta-analyses and studies have published. Do you think this is specifically related with pharmacotherapy? As you mentioned, that rapid weight loss can cause actually a rapid muscle loss as well. But those patients who are obese, they still have obesity, sarcopenia. So should we encourage more towards the physical activity, resistance training, along with the diet as well, probably to, like prevent the ongoing muscle loss in both categories?
So the obesity, sarcopenia is very... Unfortunately, we always learn by time. So when we treat patients, then those things come up, then we start learning about them. So if you look at the obesity, sarcopenia, where there's excess fat and less muscle, what will happen metabolically? So as I said, the utilization of glucose low, the same thing, even the basal metabolic rate, okay, what's supposed to be at certain level, when you have less muscle, will be lower. And the other thing, when you don't have the muscle and have the fat, the body goes into what we call the catabolic state. The catabolic state is that's with low insulin, with low IGF-1, with low growth hormone, all these contributing to the catabolic state where they might have even sometimes a mild acidosis. On top of that, if you look at the clinical outcomes, and we know that from the lots of data, the cardiovascular diseases is much higher. And not only that, even the recovery from the chronic illnesses with obesity, sarcopenia is much slower. Discharge from the hospital when they have surgery is much, much slower. So one of the fundamental things is, okay, patient will lose weight, but not to go to functional state where they can't do physical exercise, and we have to customize the physical exercise. Okay, resistance exercise is very important in those cases, because if you don't do it, this is what will happen. And the other important fact is, if with the regular checkup, when you have too much fat in your body, even if the vitamins and the trace element, concentration-wise, they are within right, but they are embedded in the fat, stored in the fat cell. So although the patient have them, but they will not have benefit of those, unfortunately, as active forms. And one of them is vitamin D. And we know that from the bariatric surgery we used to do before. And now, one of the important things is, and that's why the education is very, very important, that to say to the patient, well, the physical activity is very important. And if patients have fat and they don't have muscle, because one of the important things, Dr. Fauzia, and even us sometimes, we don't think about it, we think the skeleton carry the weight. It's not. It's the muscle carry the weight. True. And what keep us in shape? The muscles keep us in shape. And that's why when we get older, we become shorter. It's true. Because the muscle bulk is less. And we have to pay special consideration for those who are vulnerable, those with elderly, those who they have chronic diseases, those who they have any physical functional disability.
I agree with you absolutely, actually. And what do you think that how to make objective assessment for those patients who are happy with their meter is happy, weight is going down, but how to make them aware objectively that what are the measures we can use in the practice
Well,
for muscle mass measurement.
thank you very much for asking this question, because we're always happy with the figures.
Yeah.
Healthcare professional and patient and everybody and targets. And so they come and say, well, we lost 15 kg. But it's very important that we reassess those patients. And more than often when we talk about patients with obesity and overweight, what we usually do, we give them the diagnosis, we give them the treatment or the surgery, then we leave them. When they come back, we should assess them and reassess them systematically. So the first thing, an important thing, how they are doing clinically. So we ask them about the fatigability, we ask them about what's their tolerance to the exercise, we're asking them about what's their frailty, are they feeling better when it comes. So clinical assessment is very, very important. The second thing is the examination. So they are specific tests. Of course, when you see a patient, you will go through the systemic examination and evaluate the patient as a whole, but very, very important that we do the test with specific to the muscle. So hand grip is very good indicator for the whole muscle strength.
Definitely.
So that's very easy when you shake hands of the patient, and there are measures for the hand grip we can use. The second thing is just what we call the chair stand test.
Okay.
So while they're sitting in the chair, just ask them to stand up and see how they do it. And this is
Very good
recognized measure
yeah.
for the strength of the muscles. Even when they sit on the table, how they sit, it's again a very... And the direct assessment to see the actual muscle mass and the fat is the DEXA scan is very good measure. That's the standard one we do. And the second one is the bi-directional embedded balance, which again give us a very good thing when it comes to the muscle mass in comparison to the fat mass, and it's give you the distribution as well.
And it's very commonly available as well.
Yeah,
by
and it's
body analysis, every nutritionist is
Yes.
keeping them in their room nowadays. Every gym is having it now. They do the full body analysis nowadays.
Absolutely, and patients like it because you show them the proof of that. And also, when you have the three together, you will be able even to go step by step and discuss that with the patient. Okay, although you lost this, but unfortunately, you have to do this and this. No, you do absolutely fine. And you can see the progress if you have tangible measures in your hand.
Yeah, I think it's very important actually, because I think if any healthcare providers or general audience are watching us, we cannot deny the many benefits of obesity treatment. It is undeniable that many complex diseases, including cardiovascular disease, polycystic, everything gets better. Even you can have remission of the diabetes, but they have to be mindful that there is a risk of sarcopenia, there is a risk of muscle wasting, and they have to have under proper evaluation. They should not sit at home and keep injecting themselves or keep just taking macronutrients. People are much aware of the macro and micronutrients, but do not know how much to consume and how much to take. So always to remain under surveillance. And what do you think, who is at high risk? You mentioned elderlies and those who have physical disability. How we can help them regarding this, because many of them also, on whether a reason of obesity or whether a reason of part of their metabolic disease, are taking some kind of pharmacological treatment. This particular population who's stay home and they do not have that much access to physical activity, is there something we can help them out to avoid, at least, because they are the more frail and they are carrying the most risk for sarcopenia, risk of fall, risk of mortality, and all that increase with losing muscles?
Yeah, one size doesn't fit all. And one of the key important things we are doing in medicine these days is individualization. So if we look at the vulnerable group, who they have to have individualization, on the same time, they have to have more care. So for example, we know from lots of evidence, age. So, for example, if you look at the balance between the fat mass and the muscle mass between up to 59, it's like patient, they lose less than 20%. Then if they goes above 59 to 79, they lose up to 29% of the muscle mass. Then if it goes to up to the above 80s, it's more than 50% of the muscle mass lost. So those patients, they have to have a certain precautions because they are more frail, they might have fracture. So even the exercise which we ask them to do, it needs to be a safe one, which customized to their status. The other thing, patient with diabetes. Patient with diabetes, when it comes to the weight loss, in most of the obesity trials, those who they have obesity and they have overweight and diabetes, three together, the amount of weight loss is less, but unfortunately it's more of fat rather than muscles. And they already have less muscle bulk. So those one, we have to make sure they don't go to any catabolic state to lose more muscle status because they are insulin deficient. Doesn't matter whether they are type 1 or type 2. And we know that those patients, they have insulin deficiency, and we know insulin is anabolic hormone. The other group of patients who they have chronic diseases. So somebody, for example, with the cardiovascular disease, somebody with the chronic kidney disease, they are cachectic already. The other patient who they have cancer, for example, those they need very different approach. And the other endocrine disorder, for example, so somebody with caution, hyperthyroidism, all these diseases, and again the hypogonadism with low testosterone and estrogen, all these might contribute to the customizing the treatment in the future, and those who they are on steroid as well. So those group of patients we need to look at them, absolutely.
You have to be more careful for them. And I think they should need periodic monitoring also. Because if muscle loss is ongoing, so we cannot just rely on one session of education or one session of check. I think they need a periodic monitoring as well. And the more data is coming up that even after bariatric surgery, or they can lose up to 40% of the muscle mass. So this is quite significant. And another data has come out that loss of muscle mass is not simply that you're losing muscle, and it's actually directly related with mortality, which is mean that we have to take it into consideration, everything. So do you think that there is some future need to, there are people who are using over-the-counter, some kind of anti-obesity medications. They are not in a direct care, or you can say direct supervision of a healthcare provider. So there should be some kind of mass education or some kind of awareness program to make them understand that weight loss is in parallel with their muscle mass loss, and they should be aware, and we don't on the other side to undermine the importance of weight loss as well. We don't want them to be discouraged. So what efforts should we do further other than those we are directly in contact with, but you know that currently in this era not everybody is under supervision of healthcare provider for that.
I think one of the things when it comes to overweight and obesity as a disease, even by the scientific community, it's been got the CBT code recently in the last 15 years as a disease. So even in the healthcare community, we still probably we don't give that enough recognition. And we have the action study you are aware of, where we looked at how many patients they come up with out from your clinic with the diagnosis of overweight and obesity, although it's very obvious, it's only 24% of those patients. That's part of it. And the second part is the community. So the community still think obesity is not a disease and they can use the over-counter medication. But if you look at the obesity in general and the assessment they should go through for you to be able to plan for them what they should follow after and what the suitable treatment for them, whether it's lifestyle or pharmacotherapy or anti-obesity, that's very, very important. And assessment before that. Unfortunately, those who they go to, they take the medication like an over-counter medication, so they didn't any assessment, and they will not have any assessment in the future, and this is where the trouble happen. I have personally many patients who come to the clinic not only with the sort of like sarcopenia and the future disability, but patients come with acute complication. They start using, for example, higher doses, and they come with sudden diabetic ketoacidosis because of persistent vomiting, and they have diabetes. So, and more than that. So those patients, if they know, and education is the key here, if they know what might be the outcome, whether it's a clinical or whether it's metabolic or whether it's a functional, where metabolic we know all about it, it's like the cardiovascular and because sarcopenia is per se, it's a cardiovascular risk and well-being risk, and you take it, then the risk of fall, the fractures, you name it.
Yes, exactly.
If they know that, the regular assessment will be the tool to prevent all these complications, because what you want is the right advice and the replacement. Yeah. So they need, for example, the protein tailoring and what protein they should eat. They have to know what the vitamin D should be supplemented if it is low, the calcium, vitamin B12, the trace element. And this is the protocol post-bariatric surgery. It's very well documented protocol. And probably we need mass community education regarding those who they take those medicine off the pharmacy on the counter. And at the same time, it's policy regulators to make sure, apart from those who they have prescription by specialized people, they shouldn't be given, like for what they do for the antibiotic.
Yeah, this legal legislation is very important for because over dispensing without having a careful supervision can be a recipe for disaster actually for these patients. Absolutely. So we should educate our patient for nutritional intake, high protein diet, high resistant training, and keep going on the journey for obesity and weight loss. So thank you so much, Dr. Salah, for being with us. And I think that it will help our audience and our healthcare provider to understand more about how to prevent the muscle weight loss. Have a good day, everyone.
Thank you very much. Thank you.